everyone, I'm Anya Kimberly from Group 2 and today I will explain how to help a person who is choking. If a person is choking and they are conscious, and when you ask them, are you choking? And they can say yes, they can still talk. We have to encourage them to keep coughing and we will bend them over. Their body is facing downwards and we slam them on the back. And if they cannot speak, we cannot hear any breath at all, that is when we will have to use the Meinlich maneuver. So how do we actually do the Meinlich maneuver? We will take the distance of 2 fingers above the navel with this part, the strong part, onto the abdomen, and we will push a few times until the object comes out. And what should we do if someone who is choking faints and actually falls unconscious? Well, these are a few steps that we can take. So we will slowly lay them down into a lying position. We will check the airways to see if we can hear any movement of air coming out from the body. And if you don't, we will have to check their throat. So how we do this is we will do the head tilt. We will tilt their head so we can see if there is anything inside. We open their mouth and view. If the object is too deep inside for us to reach, we will continue on with the chest thrust. So what we do, we sit over them and we press onto their chest or abdomen to lodge the object out. After a few times and you can hear air, we will have to check if we can see the object has moved much closer. And if we can, that is when we use our finger to reach in. And it is very important to be very careful. We do not want to push the object much deeper inside. So what we do is we reach from the sides of the object and not press directly at the center. And we reach in and we hook onto it by bending our fingers around the object and we pull it out. And if the person is still unconscious, we will put them into recovery position and wait for professional help to arrive. So generally, we know that when someone is choking, we immediately do the Meinlich maneuver, or also known as the abdominal thrust. But does this apply the same way for obese people? No, because it is much harder to reach and actually add pressure onto the diaphragm. That is why we will use, instead of the abdominal thrust, we will use the chest thrust with interlaced fingers. And this applies the same for pregnant women as well, and it is very important for us to know in the case that anyone is choking in public. So here is a demonstration of what we should do for an obese person or a pregnant woman. Thank you so much for watching my video, and I hope this helps.